All right, well, I'm very happy to be here today. And I feel very, very blessed with everything I have and with the friendship that I have with you guys and all the nice people, friends and students and everything. So today they asked me to speak. Oh, I have a timer. That's pretty cool. They asked me to speak here, and I thought, okay, well, I don't have any pictures of camels or any picture. You know, usually people come to my seminar to get entertained. What did we learn this year? We learned that there's a camel. His name is Sugar. And then his uncle or cousin, the other camel, Casanova, came out. So, but I don't have any pictures today. So I decided to speak about something I usually share with my friends at the Life Leadership Weekend, which is my story, which I think is pretty cool. Or at least I've been told it's pretty cool. I went to medical school in Cairo, and I practiced medicine for 4 years. After practicing medicine for 4 years, I wanted to choose a specialty in medicine. At the time, I was not 100% sure what would be the branch of medicine that will fit me best. So I was talking to a lot of doctors, trying to figure out answers, what kind of income, what kind of commitment, what kind of lifestyle, what kind of effort, and all kind of stuff regarding my specialty. What would be my specialty in medicine? You know, I practiced 4 years. I did military service. I did emergency room. I worked with orthopedics. I worked with neurology, rheumatology. So I kind of been around, but really I wanted to kind of land the profession for me. One thing that was bothering me most was the amount of knowledge and information that I had, or that I thought I had. 6 years medical studies, 4 years of practicing, versus what I was actually doing on a daily basis, serving patients. Meaning, no matter how many people we see every day, whether we see 20 people or 30 people, there's about 3 to 5 different groups of medication I noticed that I prescribe almost 80% of the time. Painkillers, muscle relaxants, antibiotic, cortisone, painkiller, muscle relaxants, antibiotic. Every now and then we throw in some vitamins. If the patient is wealthy and want to be pampered, we can just put in some vitamins in there. But it caught my attention very quickly, and I don't know why. And it didn't seem to bother anybody else. But I really didn't want to spend the rest of my life doing 5 different prescriptions 80% of the time. But I said to myself, you know something? The definition of medicine means diagnosing and treating disease. Therefore, this is what it is. And the only way we know how to treat disease is with either medication or surgery. So I said to myself, you know something? Choose a specialty and go with it. And the time was kind of closing. I don't want to spend another 5th year just being a general practitioner. So at that particular time, on a different happy universe, a group of successful chiropractors were traveling the world in something similar to a mission trip on a professional level. The purpose of the trip was to go to countries and introduce chiropractic to medical schools, health ministries, and medical authority. And they went to Greece, they went to Egypt, and they went to Israel in the same trip. While in Cairo, I was walking medical school, and I saw that chiropractic presentation. I thought somebody misspelled Cairo, Egypt, says C-H-I-R-O. So I looked, it's like, what is chiropractic? They said, oh, it's a new branch of medicine. A bunch of experts from United States and Canada are presenting. So I said, oh, new branch, cool, because I'm looking. Maybe it's for me. So I walked in, and the professor was talking about chiropractic as a discipline that deals with the relationship of the nervous system to the body and how problem in the spine can reflect in the nervous system and give us all kind of problems. And he just talked about the nervous system and the spine and everything. So I said to myself, there's nothing new. In medicine, we have exact protocol for spinal problem. It's pretty exact, no matter where you go. You can go to Brazil, Germany, or US, and in all these countries, it's exact protocol, A, B, C. The first line is always painkillers and muscle relaxants. And the second line is always anti-inflammatory, whether steroidal or non-steroidal. And then we can always have an option where we can inject cortisone directly into the joint that will help the patient a little bit. And we always have the fourth option, which is a surgical option. We can fuse two vertebrae or shave off a disc or something similar to that. So I wasn't sure what's new about what they were talking about until the professor kept on saying the word without the use of drugs or surgery, without the use of drug or surgery. So I wasn't sure if my English was deceiving me, which it does, or I was missing something. So I actually had to stop the professor. I said, did you say no drugs or surgery? And then he said, yes, and proceed to explain and show us pictures and x-rays and everything. And then all of a sudden, it hit me what they're trying to say. These guys is looking at the spine in an entirely different way that medicine have ever looked at. They look at the spine as an organ, as a dynamic organ. And through years, they have studied the spine, and the identified area in that spine have what is known as maximum nerve interference. And also through the years, they have developed technique that they can actually remove these areas of nerve interference on a simple table, by hand, or with a simple instrument. And when they do that, they allow the nerve to flow freely through the body, which will give the body 100% expression without the drugs, without surgery, without anesthesia. It's done in a simple outpatient setting, and the process is entirely painless. Who wouldn't like that, right? So as soon as I heard this and I kind of grasped this, I said to myself, I want to be a chiropractor, right then. Because it answered my own personal questions. I had lots of questions and lots of doubt. That day, all my answers, pretty much, all my questions are being answered. So, and I'm not speaking on behalf of medicine. I'm speaking on behalf of a young doctor that had lots of questions. I wanted to do well. Chiropractic answered all these questions for me. So I decided to be a chiropractor, and that's the first thing that occurred to me. The second thing that occurred to me, and when I shared that with all my medical doctor friends, they said, you're absolutely right, is medicine have failed to identify the spine as an organ, and I don't know why. I'd like to say that, so I'm going to repeat it, because I like the sound of it. Medicine have failed to identify the spine as an organ. Reason I said that is when I was looking for a specialty in medicine, I had about 100 options. You can have any part of the human body have a specialty in medicine and subspecialty. You have a rheumatologist, hematologist, hepatologist, rheumatologist, endocrinologist. You have a gastrointestinal pediatric allergist, and you have all kind of specialty. The only part in the body that went through the blind spot of medicine is the spine. And when I shared that with all my medical doctor friends, they said, oops, you're absolutely right. Anything in the spine is painkiller, muscle relaxant, injection, and surgery. So, and that's why I strongly believe, and I do know, that chiropractic is in place to provide this big void in healthcare. And that's why one of the most progressive profession right now, and that is why I feel so lucky, and I know you do too. So I decided to become a chiropractor. And that's a good thing. So I decided I'm going to the United States College of Chiropractic. Have you seen Eddie Murphy movie when he was coming to America and at the barber, and he says, what university you go to? He says, I'm going to the University of the United States. Well, there's no University of the United States. But so I thought I'm going to go to the United States University of Chiropractic, but there was no University of the United States of Chiropractic. There's 17 different chiropractic colleges. And each one of them, or each group of them, have different theme, philosophy, concept. So that was a different search. Where do I go as a chiropractor? And when I say search, I didn't mean like Google chiropractic, boom, because 28 years ago, we didn't have that. As a matter of fact, probably 20 years ago, we didn't have that. Yeah, kind of. So the search was going to the library and ask these doctors about the names of the colleges, and then try to find out, and then you write a letter, or you type a letter, not with a computer, that you can make a mistake and immediately, no problem. If you make a mistake with this typewriter, it's a problem. Anybody know what I'm talking about? 3 people? Okay, good. You write it down, you put it, you go to the post office, you mail it. You wait for 2-3 weeks, and then they bring you stuff. And that's how you search during my time, the dinosaur time, the before technology time. So, long story short, I had a mentor, cousin, Dr. Alatar. Some of you probably know him. He kind of helped me making that decision. And ultimately, I decided I want to go to Life University. And I came here, spent 3 years in a class, graduated, doctor of chiropractic, took my boards, did the whole thing, and have a beautiful doctor of chiropractic degree. And Dr. Rubin was one of my classmates. When I asked Dr. Rubin, his son, so I run into his son, and his son says, you know Dad? I said, yeah, your dad was the smart guy in the family. So I was actually trying to be nice to his dad. So I said, Dr. Rubin was my classmate, and he was the smartest guy in the family, smartest guy in the whole class. So your son went and he says, Dr. Elsangak used to cheat from Dr. Rubin. I said, how did you change a compliment into this? It was like, I said he was smart. He was really the smartest guy in the thing. So I'm trying to kind of pimp him up a little bit. And the word pimp is not offensive. Pimp means like pimp my ride, make it nice. So I was trying to pimp him up a little bit. But so he misunderstood when I said he's smart. He said like Elsangak used to cheat from Dr. Rubin, you know. I might have done it once or twice, but, you know, not through the whole thing. So I came to Life University. I, again, graduated, practiced chiropractic here. Some of you don't know that I worked for Dr. Sid Williams. Upon graduation, immediately, I spent 2 years in his clinic in Lithia Springs, and spent sometimes Dr. Sanders. And then after that, that's the beauty about chiropractic. I like to travel. Some of you noticed that. So I had the opportunity to work in England, in the Anglo-European College of Chiropractic. They gave me a contract to run the outpatient clinic. So in 1993, I went to England, and I was supervising the outpatient clinic in England. And England have an entirely different scenario as far as thinking. It's pretty musculoskeletal in nature. However, there was a lot of students there that are really open to chiropractic. So I was telling my student in the class, one of the best things that I've done as in academia is really non-academic. Because when I was in England and seeing some of the students, and I was actually teaching philosophy and technique and so on, I noticed that some of them were really eager to kind of learn more. So I was also coaching soccer, so we had 25 students from England travel to DE here in Atlanta. It was in his venue, and they attended one beautiful DE, 3-day DE, and spent 7 days in Atlanta under the auspices of playing soccer with Life University soccer team. So we actually have a soccer game, and 25 students from the Anglo-European College came here and really enjoyed the beauty of the true chiropractic principles and philosophy. And among these people, you will see most of the people that are hosting our programs in Europe, like our program in Sweden, our programs in Italy, and our programs that's ultimately going to be in Germany and Scotland. All these are among the people that actually came with us here to Life University and spent a beautiful week for the DE. So, pretty cool. So I got 3 minutes left, which now I will talk about myself again. As I'm traveling, now I'm a doctor of chiropractic, and I'm practicing in the US, teaching, and then I have a contract in England. It was pretty cool. So now I'm in England. I go to Egypt and visit my family. I have a younger brother, Dr. Elsangak. My younger brother, he was a surgeon. So as I'm traveling to Egypt, he kind of talks to me. He says, so what is this chiropractic thing? I says, you know, it's a really good profession. And I talked to him a little bit, and then he seemed to be very interested. But I told him, you're a surgeon, you always want to be a surgeon. So he says, yeah, but you know, I think what you're up to is something really interesting. I said, you know something, you're my brother. Do what you have to do, look for it, search it a little bit, and make a decision. Probably 3 months later, he called me. I was in England at the time. And he says, you know, I talked to a lot of people. I think I want to be a chiropractor. I said, you are not going to regret it. He said, fine. So he did his homework, and then he says, where do I go? I said, you probably want to go to Texas or Parker or California or something, so we don't be boring, like, you know, two people going from the same place. So you go someplace else, and just so we can have like a different opinion, everything, and we'll fight, and who is better, which I know I would be. So he says, okay, I'll look into it. And then the conclusion, he said, you know something, you're my older brother and everything, but I appreciate everything, but I decided to come to Life University. So he came to Life University, graduated, and he's a little smarter than me because after graduation, he went back to Egypt, got his boards and everything, go back to Egypt, practice chiropractic in Egypt among 5 chiropractors. All of them graduated from Life, and he's doing extremely well. So if you're thinking about being a chiropractor, or you are a chiropractor, I think you're very lucky, as I am, as I started. Very lucky to be here, very lucky to share my story with you, and I thank you very much for your attention.